Bismillah ar-Rahman ar-Rahim. This lecture, first lecture in the crown and the bridge. We started crown and the bridge with the principle of tooth preparation. Principle is very important in the work of the crown and the bridge. Principle means should be. All the principle should be done to have a successful work and long time duration of the crown and the bridge. The teeth, when prepared, must be based on the fundamental principle from which basic criteria can be developed to help predict. The principle of tooth preparation divided into three broad categories. First one, biological consideration. In the biological consideration which affect the health of the oral tissue. Health of the oral tissue as a tooth, gum, cheek, tongue, all the oral tissue. Second category is mechanical consideration, which affect the integrity and durability of the restoration. In the mechanical consideration, to get a long duration time, durable bridge, and integrity of the bridge. It means that the bridge successful for many years. Three, aesthetic consideration, which affect the appearance of the patient, the success of the prosthesis treatment. As we know, the aesthetic is very important in the crown and bridge work. So the principle should be followed in the work of the crown and the bridge. Biological consideration. The adjacent teeth, soft tissue, and the pulp of the tooth being prepared are easily damaged in tooth preparation. So, all these should be protected to prevent trauma or damage to the adjacent tooth and pulp and other tissue, because any defect or trauma to these tissue will lead to failure of the bridge with the time. The adjacent teeth, iatrogenic damage. Iatrogenic damage means that the dentist will cause the damage to an adjacent tooth. It is a common error in dentistry. Even if damage proximal contact, if damage the proximal contact area is carefully should be. If we do a damage to the adjacent tooth in crown bridge or in operative or in any work, should be number one, reshaped the damage. Second, polish the damage. 3, fluoridated the damage. All 3 repair to the damage should be done to prevent caries in the future. It is more susceptible to dental caries. Avoid the adjacent teeth by number 1, metal matrix band around the adjacent tooth for protection. We band the adjacent tooth by the metal matrix to protect it from the preparation. Second, leave a slight lip of thin of enamel without resulting in excessive tooth reduction by using a thin tapered diamond. As we see in this picture, this arrow indicate the thin lip of enamel. Soft tissue protection Tongue and cheek can be provided by the carefully retraction, because this tissue is very delicate and easily injury. With the aspirator tip, in this picture we can see the aspirating tip and mouth mirror or a flanged saliva ejector, as we see in the middle picture. Pulp. How can to protect the pulp? Pulp degeneration that occur many years after tooth preparation has been documented in the operative and crown bridge. Maybe come patient to the clinic with the pulpitis. When we look the tooth have a pulpitis, we look at a previous filling or previous crown. So that means the dentist will do a preparation, will act as a trauma to the pulp, and will lead to pulp degeneration before maybe 3 years. So, extreme temperature, chemical irritation, microorganism can be cause an irreversible pulpitis. After the preparation of the crown and the bridge, should be covered the prepared tooth with the bond, acid H and bond, to protect the tooth from the chemical irritation and microorganism. And during the preparation, should be used a diamond bare new and with the water spray cooling. Can cause maybe without these maybe have a reversible pulpitis. Another notes, pulp size which can be evaluated on a radiograph decreases with the age. So keep in your mind the young patient may have a large pulp chamber, so should be prepared carefully. But in old age, as we see in this picture, the old age have a reduction in the pulp and the pulp away from the preparation. So the redness of the tooth means that the tooth have acute pulpitis. Causes of the pulp injury. Temperature considerable that is generated by the friction between a rotary instrument and the surface being prepared with the high-speed handpiece. Feather light touch. Number 1 should be feather light touch of the bare to the tooth without continuous and pressure touch to the tooth. With the water spray allows to efficient removal of tooth material with the minimal heat generation. So the water spray is important to removal a tooth material during the preparation, number 1. Second, to minimal heat generation. The spray also removes debris, which is important because collagen reduce the cutting efficiency. So the water spray will increase the cutting efficiency. Conservative of tooth structure. During the preparation of the abutment tooth or retainer, they conserve as much tooth structure as possible, while preparation design remain consist with a mechanical and aesthetic principle of the tooth preparation. Tooth structure is conserved through the adherence to the follow guidelines. Number 1. Use of partial coverage rather than complete coverage restoration. As we see in this picture, we use a partial coverage retainer rather than complete coverage retainer due to conserve the tooth. Second, preparation of teeth with a minimum practical coverage angle taper between axial wall. As we see in the picture at the right side, we can see the tapering. When we increase, this will lead to more repair from the tooth. So, to have a conservative preparation, the taper should be less as possible to prevent loss of the tooth tissue. 3. Preparation of the occlusal surface so that reduction follows the anatomic planes to give a uniform thickness in the restoration. At the left picture, we can see the preparation of the occlusal surface, the same anatomy with the normal anatomy. So the V-shaped occlusal surface is very important and good to have a crown with the normal anatomy tooth. Preparation of the minimum axial surface so that, if necessary, teeth should be orthodontically repositioned. As we see in the right picture, when the tooth tilted more, we can't preparation and make it normal angulation because will lead to more preparation. So correction of the angulation of the tooth, these will lead to conservative preparation without more preparation to the tooth. So in angle teeth should be do a orthodontic treatment to correct the position and angulation of the tooth. 5. Selection of a margin geometry that is conservative and yet complete with the other principle of the tooth preparation. As we see the blue arrow, this is a finishing line. So the should be select the less prepare finishing line without deep finishing line for conservative preparation. 6. Avoid unnecessary apical extension of the preparation. The level of the finishing line should be not apical extension to prevent more trauma or more preparation to the tooth. To make the tooth more conservative should be do the finishing line more supragingivally. 3. Consideration affecting future dental health. This consideration affect on the health of the mouth during the future. A. Insufficient axial reduction inevitably result in other over contoured restoration that hamper block control. This may be cause periodontal disease. When we insufficient reduction of the axial surface, so the crown will come from the lab bulky, more contour, over contour. So the over contour, as we see in the middle picture, Over contour will lead to more undercut below the over contour. These undercut will have to plug contaminated and maybe lead to gingivitis with the time. B. Inadequate occlusal reduction may result in a poor form of subsequent occlusal dysfunction. Inadequate occlusal reduction will lead to the crown act as a flat occlusal surface and inefficient in the occlusal efficiency, and lead to, during mastication, the force will act on the tooth laterally, and this will affect on the periodontium. Wherever possible, the margin of the preparation should be supragingival. Advantages of supragingival margin include the following. As we see in this picture, this preparation have a supragingival finishing line. We do a supragingival finishing line in case to have a good benefit. Number one, easy to preparation accurately without trauma to the soft tissue. We can see the preparation supragingivally without defect or trauma to the gingiva. Two, they can usually also be satisfied on hard enamel, whereas subgingivally margin are often on dentine or cementum. Supragingival finishing line, we satisfied that the bridge seated in the hard tissue in enamel, but the subgingivally the crown will seated on the dentine or cementum. 3. They can be easily finished without associated soft tissue trauma. They are more easily kept plug free. Impression are more easily made with the less potential of soft tissue damage. Supragingival finishing line, easily finished without interfere with the free gum, and easily cleaned from the patient after cementation because the finishing line exposed, and the impression is very simple without complication of the deep sulcus, and potential soft tissue damage less. 4. Restoration can be easily evaluated at the time placed. With the time when they check the bridge, it's easily to evaluate the finishing line. Subgingival marginal, however, is justified if any of the following portion. Number 1, dental caries, cervical erosion or restoration extend subgingivally, and the crown lengthening procedure. In case of cervical caries, in case of erosion cervically, in case of we need to lengthening of the crown, we need lengthening of the crown to have a good retention. All these will be do a finishing line subgingivally. 2. The proximal contact area extend to the gingival crest. When the proximal contact below or near to the gingival crest, so should be do a finishing line subgingivally to do a good contact with the adjacent tooth. 3. Additional retention resistance is needed. In case of subgingival finishing line, we have a long tooth. In case of long tooth, we get more retention and more resistance. 4. Margin of metal ceramic crown is to be hidden behind the labiogingival crest. In case of metal ceramic, we do a finishing line subgingivally to hidden the metal color to have a good aesthetic. 5. Root sensitivity cannot be controlled by the more conservative procedure, such as the application of dentine bond agent. In case of root sensitivity, cannot controlled by more conservative procedure, application of the dentine bond agent. Mechanical principle consideration can be divided into 3 categories: provide retention, provide resistance, provide deformation of the restoration. Number 1, retention. How can get more or good retention for the bridge? Certain force when the jaws are moved apart after biting on very sticky food. The retention will cause the retain of to prevent opening of the bridge from the tooth, act as a cemented restoration in the same direction as the path of placement. The following factor must be considered when the dentist decides whether retention is adequate for giving a fixed restoration. Number 1, magnitude of dislodgement force. The magnitude of the dislodgement force exerted by the elevator muscle depends on the sticky of the food and the surface area and surface texture of the restoration. Sticky food with a large surface area will lead to removal of the bridge. Geometry of the tooth preparation. Taper. Tapering of the surfaces, axial surfaces of the prepared tooth. It's defined as the convergence of 2 opposing external wall of a tooth prepared. Skillfully prepared axial wall at a minimal convergence. As possible, you do a minimal convergence. Very conservative of tooth structure and better retention. The recommended convergence between the opposing wall is a 6 degree. Maybe the bear tapering have a 6 degree. So when you use a bear, Fisher bear for preparation cone, have a cone shape with the 6 degree, this will lead to have a 6 degree convergence between the opposing tooth. Surface area. The retention depends on the length of the path of insertion area that is in sliding contact. Therefore, crown with the tall axial wall are more retention than these are short axial wall. Molar crown are more retention than premolar crown of similar taper. Because of the greater diameter of the molar, to retain of a complete crown is more than double that a partial coverage restoration 3/4 crown. So the more surface area prepared tooth have more retention than less surface area, same premolar or 3/4. Stress concentration. When a retention failure occurs, cement often adheres to the tooth preparation, and the fitting surface of the restoration. In these cases, cohesion failure occurs through the cement layer because the strength of the cement is less than induced stress. Sharp occlusal axial line angle should be rounded and minimize these stress. The stress on the bridge will transfer to the tooth and cement. So this stress, when increased, lead to failure of the cement. So during the preparation, the prepared tooth should be free from the angle, sharp angle or point angle, to prevent the stress transmitted to the tooth. Roughness of the fitting surface of the retention is increased of the restoration, is roughened of grooved. Failure rarely occur at the cement tooth interface through the deliberately roughing of the tooth hardly influence the retention. So more roughness of the prepared tooth will lead to more retention. But in case of have a choice resin cement, the roughness is not important. 5. Materials being cemented. Adhesive resin cement are the most retentive than the other loading agent. As we see in this table, when we need to increase the retention, should be increase the surface area, decrease the tapering, preparation. Tooth should be, when large tooth we have get more retention. Surface texture, roughness, more retention. Thickness of the cement, when thin film of the cement will lead to more retention. Loading agent, resin cement is give a more retention. Resistant form is the prevent dislodgement. Resistant, it's a prevent of the dislodgement of the cemented restoration. The dislodgement come from the mastication and para-functional activity, may be subject prosthesis to substantial horizontal or oblique force. Laterally force tend to displace the restoration by the causing rotation around the gingival margin. Rotation is prevented by any area of the tooth preparation that are placed in a compression called the resistance area. So the resistance area act to prevent rotation of the crown due to mastication and parafunctional activity. Adequate resistance depends on the following: magnitude and direct of the dislodging force. In a normal occlusion, biting force is distributed over all the teeth. It is axial direction. If a fixed prosthesis is carefully made with a proper design occlusion, however, if a patient has a biting habit, such as the pipe smoking or proxing, if our defect to prevent fairly large oblique force from being applied on the restoration, Consequently, the complete tooth preparation and restoration must be able to withstand considerable oblique force. So the preparation of the tooth should be done to resist the lateral force, to resist the oblique force, to withstand the considerable oblique force. Geometry of the tooth. Resistance is increased when the axial wall taper is decreased. Decrease the tapering, increase the axial wall length will lead to more resistance. Preparation diameter increase and preparation height is longest. A partial coverage restoration maybe have less resistance than a complete crown because it is a non-buccal resistance area. Here, resistance is provided by a boxes or groove. To increase the resistance may be done additional resistance forms such as boxes or groove in the prepared tooth to have a good resistance and good geometry. 3. Physical preparation of the lotting agent. Resistance to deformity is affected by the physical properties of the lotting agent such as compressive strength and modulus of elasticity. The resin, the cementum should have a good compressive strength and have a modulus elasticity to withstand the oblique force. Glass ionomer cement and most resin have a high compressive strength, whereas polycarboxylate have a similar value to these of zinc phosphate cement. Preventing of deformity. Deformity means that we'll have a slight curve of the long bridge. So a restoration must have a sufficient strength. In long bridge, should we have a sufficient strength to the bridge to prevent deformation. Prevent permanent deformation during the function. This may be a result of inappropriate alloy. Deformity may come from the selection of the type of the material, inadequate tooth preparation, or poor metal ceramic framework design. So the causes of the deformity of the bridge. Number 1, not sufficient thickness of the bridge. Number 2, select materials it's weak, not resist the deformation. Number 1, alloy selection. Although type 1 and type 2 gold alloy are satisfactory for intracoronal cast restoration, they are too soft. Yeah, this type of the gold is very soft, not do a bridge, but we can do it a crown. For which type 3 and 4 of gold alloy, appropriate low gold alternative are choice metal ceramic alloy with a high noble metal content, have a hardness equal to the type 4 gold alloy. So the hard metal, stiff metal is very good for do a bridge, especially in a long bridge. Whereas nickel chromium alloy are considerably harder. These may be indicated when a large force are antecedent, such as a long span fixed dental prosthesis. Adequate tooth reduction. Even the stronger alloy need to sufficient bulk. However, if they are to withstand occlusal force, a minimum alloy thickness of about 1.5 millimeter over the functional cusp in the mandible, lingual, and the maxillary, the functional cusp. So The less stress non-functional cusp can be protected with the less metal 1 mm. Adequate must be circumstances for a strong and long-lasting restoration. In functional cusp, we should have a sufficient thickness to have a 1.5 thickness of the metal because the functional cusp have a more force than the non-functional cusp. 3. Margin design distortion of the restoration margin is prevented by the tooth reduction should provide sufficient room for the bulk material marginal to prevent distortion. For example, a disadvantage of the feather edge preparation is that the resulting thin layer of metal is not as strong as the comparatively thick restoration. So the thick finishing line, such as deep shoulder, is more strength to the thin finishing line, such as the feather edge. So the groove and ledge incorporated in a partial partial coverage preparation provided essential strengthening for the cuts. So in case of bridge need to more strength should be have a sufficient thickness, more thickness, and deep and more thickening finishing line, and maybe in 3/4 crown should we do a slice. In aesthetic consideration, in case of ceramic or metal fused ceramic, the dentist should develop skill in determining the aesthetic expectation of the patient. In all ceramic, some of the most pleasing aesthetic restoration are all ceramic crown, inlay, onlay, veneer. They can be mimic original tooth color better than the other restoration options, although at somewhat greater risk of brittle fracture. The newest materials have improved physical properties and can be strengthened through the cause of the resin bond loading. In all ceramic, when we use Emax is brittle. So we need to more added thickness to the restoration. The added thickness have a two benefit. Number one, increase the aesthetic of the bridge. Number two, to increase the strength of the bridge. In case of Emax. But in case of zircon nowadays, we can't need a thickness because the material is have a high compressive strength and good aesthetic. Metal ceramic restoration. The principles are recommended during the teeth preparation that ensure sufficient room for porcelain and accord placement of the margin. Otherwise, good appearance would be achievable only at the expense of periodontal health. If there is no sufficient bulk, if porcelain for appearance and metal for strength, adequate reduced of the facial surface is essential. A minimum facial reduction of 1.5 millimeter typical is required for optimal appearance. Adequate thickness of porcelain is needed to create a sense of color, depth, and translucency, and initial reduction of 2 mm is recommended for good aesthetic. In case of metal fused bridge, in the aesthetic area labially should be prepare depth 2 mm to have a good aesthetic appearance. At the end, we conclude 3 principles we should be done in the preparation of the crown bridge. Biological principle, conservation of tooth structure, avoidance of the over contouring, supergingival margin, harmonies occlusion, protection against tooth fracture. Mechanical principle to get more retention, resistance, and more resist to the deformity of the bridge. The more consideration in the aesthetic, it's minimum display of the metal, maximum thickness of the porcelain to have good aesthetic appearance, porcelain occlusal surface, subgingival margin to hidden the metal line subgingivally. Thank you very much for listening.